Hi, my name is Anika Majaria and you're watching Dubai Live TV. Today I'm at the American Hospital with Dr. Senthil Meenrajan, who is a geriatrician here. Hi, thank you for being here today.
Nice meeting you.
Could you please talk to me about your role as a geriatrician and what areas you enjoy working in the most?
As a geriatrician, as you're aware, we primarily deal with the older patients. Geriatrics specifically, we deal with a lot of the medical issues, which are common even in the younger folks, like diabetes, hypertension, but we focus mainly on things that are more specific to the older patient. Memory problems, you don't see that often in younger patients, or it's not a major concern in their lives, but as people get older, it can affect how they live. There are other things such as a fall risk. Falls are generally not considered a major problem in young folks. Other small things that people come with are urinary incontinence. Even though we talk about it as a small issue, for the person who has these symptoms, it can become a life-limiting symptom. So there are things that are called geriatric syndromes, which would be like dementia, memory problems, osteoporosis and fall risk and fractures, urinary incontinence, and certain bowel and bladder issues that we deal with specifically. In general, our goal is to improve the function of the patient. We try to deal with all of these together to see how they actually affect the quality of life for the patient.
With regards to technological innovations, what advances are there in your field that can help to treat elderly patients?
The diagnostic modalities are rapidly changing. Whereas we used to have to depend only on clinical tests a few years ago to make the diagnosis, now we can make the diagnosis much sooner. There are scans, although I should say that we're not using them regularly, but when there is a question, there are scans that we can fall back on, certain tests that you can go back to make an early diagnosis and a more accurate diagnosis. And that sort of helps you with the treatment. Right. There are more and more drugs coming into the market that help with memory. Every day I see new technology in the market, a new app, even a simple thing that can be downloaded onto their phones that gives them reminders.
Could they use smartphones or iPads to help with cognitive games or mental stimulation, things like that?
Definitely yes. For the short term, yeah, I think that's a great solution, but it's hard to keep someone at home engaged on these phones for a number of hours, say day after day. That becomes a monotonous routine, right, which they will not stick to. So having centers where people can go to would probably be a better way to do it. And there is always the camaraderie of interacting with other people, right, your age, right. There's definitely an element of that, but any little technological help is definitely going to be an added benefit.
Do you think it helps with the elderly patients here? Now, a lot of them tend to live at home with their families, whereas in other areas, in other cities around the world, like the UK, a lot go into homes. Do you think that makes a big difference?
I should categorize this with another statement, which is we have two groups of population living in the UAE. One is the Emirati older patient who usually is with the extended family. And then we have the expats who also have their parents or grandparents live with them. And they tend to usually have smaller family dynamics. In terms of just care, it is a lot easier when we have families involved, when we have bigger families. It is always easy for me to tell someone the father or mother needs to be supervised at all times, and there's 6 or 7 people at home. So the safety is ensured. So it makes it a lot easier in that sense. For some of the expat families that come to me, I find it a little more difficult because they have to go to work. The son or the daughter has to go to work and there's really nobody at home to take care of them. But obviously sending them back from wherever they came from is not an option because there's not a good social system there as well. So yes, we have a slightly different family dynamic here. Generally, it is very helpful.
That was great. Thank you so much for your time.
You're welcome.